My name's Jane Scholl. I'm the executive director of Philadelphia Fight. So we're 25 years old this year. If you reflect on what it was like then versus what it's like now, we're really living in a completely different world. This was an epidemic that from the earliest years, you could feel this tide coming closer and closer and closer, and you knew it was going to start engulfing your friends. When we started, there was one drug. We've reached the point now where we have over 30 drugs, and they're effective. We have really had fantastic leadership over the years. Our founder, John Turner, was an endocrinologist who was a gay man, and he decided that it was his obligation to come forward and take care of other gay men. If it hadn't been for him, the organization wouldn't exist at all. We did start our life as a research organization. Our goal was to end the epidemic in the lifetime of people living with AIDS now. It's been our goal all along. And while we weren't able to do that in the early 90s, we have during all of this time remained committed to that goal. We want to see this epidemic end.
I was diagnosed with HIV in September of 2001.
97. I was diagnosed with HIV in prison.
I'm 57 years old, and I was diagnosed with HIV back in 1998. The doctors gave me 3 weeks to live. My CD4 count was 4.
I found out that I was positive in 1999.
I was actually diagnosed with AIDS in 2003.
I found out in February of last year.
I'll never forget it. I was diagnosed in March of 1985 through the mail.
How does it feel to be a long-term survivor?
It's lonely. I saw all but a few of my friends die. It's like the whole club disappeared.
People used to say, oh, you're gonna die, you're not gonna live. I was real hurt, okay? Thinking that my kids was gonna not love me no more. My mom was not gonna love me no more.
It was more of the shame that I felt on myself, because now here it is, I'm putting another burden on my family as far as not only me being gay, but also now me being HIV positive.
I was fearful of disclosing my status, so I kept it secret for 10 years until I just couldn't hold it in anymore. When I first came to Philadelphia Fight to go to Project Teach, it was wonderful. So many people were just so friendly. I didn't feel judged. I didn't feel shameful. I can talk about my status. I can take the mask off and be myself. But I also learned so much about HIV. I didn't know anything at all about what was going on inside of me, and I needed to find out.
It's explained to you on layman's terms where anybody can understand it. Whatever level of education you have, you'll be able to understand what they're teaching. And that's really important for somebody that wants to know what's going on in their body if they have HIV.
John Lax was the president of our board when he died of AIDS, almost 20 years ago now. He had felt very strongly that there wasn't enough really high quality care in the city, and that it really was our obligation to do something about it. So he actually left us money that could only be used to create a treatment center. And when we did open the doors of the Jonathan Lax Center, there was no question we were going to name it after John Lax.
We can never touch the lives of our patient if we aren't connected with them. So it's very important for us as clinicians to really focus on the patient as a human being, as opposed to just someone coming with an illness that needs to be dealt with. A patient can walk in with a chief complaint of having lost his insurance, or a chief complaint of being profoundly depressed because they relapse on drugs. And it doesn't have to be necessarily a medical per se chief complaint. And we are keen on addressing those issues right there at their visit and try to hook them up with the resources.
I went to Philadelphia Fight, but I only went to have a safe space to stay. It was told to me that Philadelphia Fight has the only AIDS library here in Philadelphia. So I went in there, and I used to go to sleep because I was used to roam the streets late at night, getting high. But one day I walked in there, and a gentleman named John Bell, he said, "Hey, young fella, how you doing?" I said, "I'm all right." He said, "The help you're looking for is right in front of you."
John Bell, who was an ex-offender who had been addicted in his life, saw that there really was a need for us to reach out to people living with HIV in prison or jail. And we have the biggest population of people who've been incarcerated and who are now living with HIV.
It's people transforming other people's lives. I could easily talk about healthcare and the work we're doing in the LAC Center. I can easily talk about prevention services and how we're trying to, keep people, uninfected, helping people know their status if they are, and get into care. I can talk about even the research initiative and finding a cure to end AIDS even. But really, it's all about the people that are working in all these programs and how they make other people feel.
YHEP actually stands for Youth Health Empowerment Project. What we do at YHEP is we have a number of people who help the youth out who are homeless or just youth in general to make sure that they have things that they need.
And they basically help all type of people, LGBT, heterosexual. They give you amenities, they feed you, clothe you, allow you to wash your clothes, etc., stuff like that. I'm in the program with Philadelphia Fight for PrEP. PrEP is a little blue pill, which only is for people who are HIV negative, and it is 99% effective in reducing the risk of contracting HIV.
AIDS Education Month, which is a month of activity designed to bring attention to the AIDS epidemic, reaches 10,000 people in Philadelphia every year with conferences that we sponsor, presentations that we sponsor, a gospel concert, and a hip-hop concert for young people that we sponsor. So we reach out to a lot of people, and we directly serve a lot of people.
Philadelphia Fight is it's putting out good things in the community, and people come from different communities. They come from North Philly, West Philly, South Philly, so it's going all over the city, and that's a great thing.
And let me say this, HIV is not one of the most important things that's going on in my life today. I'm not living with HIV, I'm thriving with HIV, which is a big difference.
Right now, I'm a very happy woman. Thank God for my medicine. Thank God for Philadelphia Fight.
There's no place like Fight. That's all I can say. Just like there's no place like home, there's no place like Fight.
Thank you. Thank you from the bottom of my heart for everything that you've done for me.
I couldn't have did it without you. Much love.
We need you guys. But thank you.
I really want to say thank you, Fight, from the bottom of my heart.